Welcome to Varsity Nutrition. I'm Derek Marks, and in this episode, we're going to talk about supplements. The goal here is to really determine if you need to take supplements, and if so, which ones. I'm going to discuss the top 5 supplements that I've seen athletes need based on inadequacies in their diet or just due to using their bodies to a point where supplements are necessary because they can't get enough through food. Firstly, a bigger picture conversation about supplements. Understanding whether or not you need them is difficult. As an athlete, you are using your body much more than non-athletes, and therefore your vitamin and mineral need is going to be higher compared to other individuals. The best way for you to know whether or not you need to consume them, firstly, we can talk about symptoms, which we're not going to get into in this conversation much, but really maybe tracking your diet is going to be the best approach. See what your diet analysis says about your nutrient intake, micronutrients, vitamins, and minerals, and from that, you can make a pretty sound assessment as to whether or not you should take a supplement. Ultimately, when we cook foods and when we process foods, a lot of the vitamins in those foods can be affected. So things like vitamin C, for example, vitamin C found naturally in foods is the best way to get it. The best way to get all vitamins and minerals are through food. But vitamins like vitamin C are pretty susceptible to heat, for example. And if a food is cooked in heat for a very long time, the vitamin C actually degrades and becomes kind of useless to humans. And therefore, sometimes we might think that we're consuming a fair amount of vitamin C, and even our chronometer or other dietary analysis tool will say so. But in fact, through processing and cooking, that vitamin may have been destroyed. And that's true across multiple vitamins. So really being mindful of, sometimes I suggest athletes eating like at least one raw serving of fruits and vegetables a day to ensure that those high vitamin containing foods are consumed without being processed. Ultimately, if you're going to get to the point where you want to purchase supplements, there are some rules to follow, right? Firstly, always try and meet your vitamin and mineral needs through food first. If that's not the case, then secondly, make sure that if you decide to purchase a supplement, that you're taking it in a safe volume. So a lot of our especially minerals and our fat-soluble vitamins, A, D, E, and K, they can get toxic if you overconsume them. So please make sure that the supplement that you're taking is in safe volumes so you don't get symptoms of overuse or of overconsumption. Secondly, make sure it's an effective supplement. And there's different versions of different supplements out there. Not all are created the same. Unfortunately, you typically get what you pay for with supplements. So do a little research. There's a lot more food-based supplements out there by manufacturers that tend to be a lot more bioavailable, which means when you consume them, they actually get absorbed and go do what they want to do. Do a little background check, do a little homework to make sure that the supplement you're getting is going to accomplish that. And then lastly, don't spend too much money on them. If you can't afford a supplement, find other ways to get that nutrient in your diet. It kind of is a no-brainer, but oftentimes I have athletes spending more money than they need to on certain supplements that they may or may not need or can maybe possibly get through food sources in a much cheaper way. The first group of supplements on our list are antioxidants. Antioxidants includes a whole long list of different nutrients. Vitamin C is the one we're going to talk about most here. Antioxidants in general, they destroy free radicals in our body, which are produced from higher rates of metabolism, exposure to UV light through all sorts of different processes. These free radicals are cells that destroy other cells in our body, essentially. So consuming antioxidants, especially for athletes, becomes really critical because we have high rates of metabolism. We typically have high exposure to sun if you're playing an outdoor sport. So vitamin C and antioxidants in general have anti-inflammatory properties, which makes it really good for recovery purposes. Vitamin C specifically helps with the development of collagen, which is a connective tissue in our body. And as most of you know, it also plays a really important role in our immune system function. In terms of vitamin C supplementation, 500 to 1,000 milligrams a day is adequate. You don't necessarily need to go much beyond that. It's a water-soluble vitamin, so it's not toxic. I mean, it's really, really hard to overconsume vitamin C, but above 1,000 milligrams a day, you're probably peeing most of it out at that point anyway. Some of the research on vitamin C supplement in athletes shows that vitamin C supplementation does reduce inflammation, thereby facilitating quicker recovery time, allowing athletes to train harder sooner. Number 2, the B vitamins and magnesium. I pair these two together because they play such an important role in metabolism and metabolic processes. And as athletes, you are all highly metabolically active. So yeah, you should make sure you're getting enough B vitamins and magnesium. So the role, at least from the research standpoint, yes, athletes who underconsume the B vitamins and or magnesium tend to have issues performing high intensity exercise, right? That's a high rate of metabolism types of activities. So B vitamins are pretty widely available. So they really vary in terms of doses and combinations. There are multiple B vitamins out there. So, B1 through 12, right? So basically combination B vitamins are out there. Take them in the morning because they tend to stimulate metabolism a little bit. If you take them late at night, they may have a tendency to keep you awake a little bit. In terms of magnesium supplement, if you're not getting enough through diet, which kind of varies across individuals, really depends on your food access, 500 to 800 milligrams a day is plenty. Calcium and vitamin C, if you consume those with your magnesium, they will assist with absorption. Next group is vitamin D3 and calcium. D3 is a really diverse vitamin, and this role I'm going to talk about today is mostly about bone health. As athletes, you all need to be taking really good care of your bone, especially those of you in weight-bearing sports, which is pretty much all of them. Vitamin D also plays a role with immune function and even fat metabolism. Calcium, of course, also plays that role in bone health and really important in muscle function and nerve transmission. So they're, both these nutrients play multiple roles. Generally though, at the very least, we're talking about bone health here. Looking at doses for these nutrients, vitamin D3 is really hard to get in the diet, but as most of you know, exposure to the sun can activate the inactive form of D3 that's in our blood through UV exposure to our skin. Even so, if you're an outdoor athlete or spend a lot of time outside in the sun, a supplement can still be beneficial. So anywhere from 1,000 to 5,000 IUs per day for vitamin D3. Calcium, a little bit easier to get in the diet. Really take a look at what you're consuming. We find it in high amounts in dairy products and even the tofu and other types of products like that. If you're under consuming your calcium, up to 1,500 milligrams a day would be the max, but really gauge your calcium supplementation based on what you're consuming. Fourth in the group, your omega-3 fatty acids. Not a vitamin, not a mineral, but definitely a supplement that a lot of people take. So I included in this list because it is so valuable. The omega-3 fatty acids are an essential form of fat, so we need to consume these in small amounts every day to maintain normal physiological function. Really, the primary role of the omega-3 fatty acids is anti-inflammatory, so it helps reduce inflammation, which is that recovery process where our body does get inflamed after hard training, and as that inflammation goes away, we become better prepared to train again. So we have seen in research that athletes who supplement omega-3 fatty acids recover more quickly from training, kind of like with vitamin C, experience a little bit less delayed onset muscle soreness, thereby facilitating recovery and allowing athletes to train harder more quickly. Pretty important nutrient to take as well when athletes are injured and recovering from injury, of course. When it comes to omega-3 fatty acid dosage in terms of supplements, 1 to 3 grams a day, and usually split morning and evening is ideal. It's those fish oil capsules, but there's other forms as well. There's even plant-based forms if some of you prefer that. Finally, let's talk about iron. Iron is probably the most consequential nutrient if it's in low levels in our body amongst all the ones that I talk about today. If you have low iron, you're going to know it. You're going to have chronic fatigue. Your performance is going to be pretty bad. You're going to have other symptoms associated with anemia, and you generally don't feel good, and training isn't generally very effective. So depending on the level of that anemia. One of the most important things I can say here, though, is be mindful of iron supplementation. It can be quite toxic. And if you have normal iron levels and take a large iron supplement, getting to toxic iron levels is quite dangerous. So please always have a blood test done before you jump in and buy any, type of iron supplement. The primary function of iron is to transport oxygen in our blood, on our red blood cells and hemoglobin, to the tissues where that oxygen can be used for metabolic purposes and generate energy to do work. A little graphic from our friends at My Sports Science, Asker Jukendrup and his team. They put together these wonderful graphics, these wonderful slides. There is this table on the bottom here where I know the closed captioning is covering it a little bit, but that table is really what I want to focus on the most here, or for you to focus on. And it kind of lists the different levels or stages of iron deficiency. So when you get a blood test and it comes back, you can look at a chart like this to better understand where you're at, right? And so you have a blood test for iron will give you different sort of values. Serum ferritin, hemoglobin concentration, and transferrin saturation are three typical ones. You might get some others as well. But have a look at these to know at what stage you're at. And from stage 1 to 3, 3 is going to be the most severe, where you are basically low in everything, right? In terms of supplementation, even if you have normal iron levels, a very small iron supplement can be okay to take. But again, I always, you have to know whether or not your iron levels are normal or not. So please have a blood test done. Sometimes on iron supplements, you'll see two different numbers, a higher and a lower number. And so the higher number that is shown is the binded iron amount. So iron doesn't come by itself in supplements. It's usually bound to something else. And so the combination of iron and that other element that it's bound to is given as a combined volume or weight. If they give you a second number, that's a lower one, that is called elemental iron, and that's the actual amount of iron in the supplement. So generally, you don't want to exceed 15 to 20 grams of elemental iron in any supplement, but you will often see the binded iron amount be quite high. Even I've seen up to 40s and 60s for that, but that typically doesn't reflect how much iron is in the supplement. In terms of absorbable forms, iron bisglycinate and iron glycinate are probably the two most highly absorbable forms. You'll also see things like ferrous sulfate, ferrous fumarate, and ferrous gluconate, also very absorbable and kinder on your stomach. Sometimes iron supplements are pretty mean to your stomach and cause some gastric upset. To maximize iron supplements, take them with vitamin C, but also important, avoid taking them with calcium-containing foods or calcium supplements or antacids if you take antacids. Those will limit or block iron supplementation. That's it for this time. We'll see you next time.